Thoracic outlet syndrome can be extremely problematic for people, but can be a really easy fix. So if you are experiencing numbness, pain, tingling in your arm all the way down to your hand, a lot of people start to get really panicked that it is their neck and it's coming from their spine. Oftentimes it is simply we need to get some soft tissue mobilized, maybe the clavicle or collarbone mobilized. So I'm going to show you some things today that will hopefully help with those symptoms that you're experiencing. But just a quick overview of what exactly is going on in there. So if you look here at the picture, you can see how there is the collarbone, and then underneath you have some soft tissue. The subclavius muscle plays a really big role in this, as you can see where it is positioned. So if it is tight, it can compress the nerves and blood vessels. You can also have compression up in the neck muscles. First thing I want to go over is some soft tissue mobilization. So when we're talking about the soft tissue we're going to work on, we're going to really get into the subclavian muscle, but some of the pec muscle as well. We're going to start over here, and then you're going to just press in and almost a little up under that collarbone. I do not use lubrication when I do this type of work. It makes everything too slick, and there's no way that you're going to really be able to feel what's going on. So I'm just sort of sliding, and if you feel a part that gets kind of sticky, then you're going to stop there. Take some breaths, relax. The whole time you're doing this, you are working towards relaxing more and more and more. So my shoulders slowly letting go as I'm doing this. I'm letting all that tension that we have go. You can go back and forth, but the whole time the pressure is in and up. Keep working across. Now I'm showing you guys on my right side, and after I get over here, I want to do a backtrack. I want to show you guys something on my left side for those of you that have been following me since I have a pacemaker. Now, when you get right in here, boy, this is the fun spot. This is where you'll really start to feel it. But I wanted to make sure and start over towards the middle, because we don't always just want to go straight to that particular area and what we might call straight to the source, because the reality is most of the time it's not. When we're talking about fascia, it's usually surrounding areas that cause the bulk of the issue. All right, and then I'm going to kind of finish it out. You're going to follow it till basically you're going to get all the way to the end of the collarbone here. And for me, it's real easy to see because I have this one little bony part that sticks up. And basically, that is the end there. Now, if you're dealing with a pacemaker and you're having issues on the side of the pacemaker, you'll just be a little extra careful. So right here, and you guys might be able to see, that is my subclavian vein. And that is where the wiring is. So I don't want to press specifically on the wiring, so I just come to the inside, and that would be where I would stop. I would still work all the way through until I kind of get to that inside. Sometimes I'll kind of feel ahead with that finger, kind of where I am, or you can come off the vein and work backwards is also an option. And then of course you're going to come down the other side and work through. So just make sure you're lifting your fingers when you go right over that vein for those of you that have a pacemaker. So now that we have worked through that bottom portion, we're going to do the exact same thing on the upper portion. So starting here, and then we're pressing kind of down through here as well. And we're still going to work on And this is where my techniques differ a lot from more traditional massage, where traditional massage tends to work a bit more on the muscle belly. I tend to go a lot through the attachments to the bone. So right here is pretty yucky. So I can kind of hang out there for a moment and breathe. So quite a bit of pressure here as you're doing this. And then again, I'm going to work my way all the way to the end, which will be kind of over in that bony area once again. Now, I want to show you two other things that I like to do. So that's a very direct, right to the area approach. I also like to work on pulling down the whole fascial area. So you're going to kind of grab the skin and the fascia and hold it there. And then you're going to take your head back and away, keeping your teeth closed. You guys can probably see how tight this starts to get. That's what we want. Also up in here, really tight. And then you can just work through some angles here. So that is kind of the most direct angle, but you can also just go straight back. Just play around with the angles a little bit. You can even do some rotation. Believe me, you will feel this a lot. Now, moving into the collarbone directly. This one's a little bit tough, I'll be honest with you. It's easier for someone to do this for you, but I still want to give you guys some options to play around with. So you're going to take your fingers and you're going to hook them to the inside of the collarbone. And then you have to really relax this arm. So relax as much as you can. And then you're just going to kind of let the weight of your arm and then a little bit extra pull you down. It's not like your collarbone is going to move a ton. It won't. This is not a real mobile joint. I like to add a little rotation because I also can get a little bit of deeper work than I did a moment ago. Keeping a little bit of a pull there. You can let go. And we can pull down again. So for those of us that tend to stay in this position all the time, the collarbone can get stuck up too high. I'm going to show you two stretches that are active stretches. Fair warning, these are going to be really, really tough for a lot of you, so just do the best that you can. This is one that I do with my clients where I'm assisting them. You won't have the assistance, which means this will be purely active, but I love the active part because the more active you are as the muscles are pulling you through range of motion, they are also getting stronger because they're getting a ton of resistance from the soft tissue. So really it's like a tug of war that is getting the muscles that need to be working stronger. So think of that when you're doing stretching. The more active, the more actual strength and the more education and the more likely you are to actually maintain the results. So we're going to take the hands, you're going to clasp them together behind your back. We're going to lift. When you find a sticking point, you'll breathe. Reach. Reach. And you'll just do that as much as you need to. You will find a point where you're like, that's just not going to go anymore. And that is fine for today. Ideally, you actually need to be able to get your arms to about 90 degrees. As you guys can see, I couldn't quite do that today. That's okay. On some days, I'm able to. Just depends on how much I've been working out, really. Then we're going to flip. This is where it is the hardest. When you flip here, a lot of my clients are here. Like it's so hard for them to even get here. Their elbows are really bent. They're kind of stuck here. Your goal, though, is to get here. So I would rather you not be trying to do this here. You're actually losing the stretch. First thing is to get your arms straight. So if you're here, you're just going to work on straightening everything out before you do anything else. Once you get here and you're able to have your elbows relatively straight, then you're going to start working on lifting. Same thing, breathe, reach, reach, and just keep working through there. This one will absolutely be less range of motion than what you're able to do with just this position versus the flip. Just do the best you can. Again, this is something, if you have someone that can help you just lightly lift, don't let them really pull your arms because it's going to be super uncomfortable, but just lightly help you lift can really help to just get the most out of it and just really intensify that stretch just a little bit. For the strengthening part, you are going to take a band, you're going to put it up high. You're going to grab it, pull it down with the palms facing forward. And with the palms facing forward and elbows locked, you are going to pull the shoulder blades down and back. From there, you're going to pull the hands back and out a little bit so that you're making this band come around your legs. Then, once you're set up there, we're going to just release the shoulder blades and squeeze them back again. Release and squeeze. You can pull back further and further apart if you need to. This one is crucial for you to have the elbows locked here. If the elbows are bent, you will not get the same thing out of this. So again, palms facing forward, elbows locked, shoulder blades down, pulling, squeeze. You can start with a really small band like I have here, and then you can work your way up to a bigger one, but it is a pretty difficult exercise, especially to start. So I would probably start with a small one. A really great option is a hold. So just getting here and just breathing and holding. What I like about a long hold time is it gives your body an opportunity to see where you're holding tension. So I'm kind of doing an analysis as I'm going through here. Like my left elbow likes to try to bend a little bit. So I'm going to straighten it back out. Right one's doing okay. A lot of you might find that your shoulders will try to raise up. Again, you're going to keep them down and back. Squeeze together. Lock, lock. Make sure you're breathing. I don't want you holding a lot of tension everywhere in the body. So you're just going to hang out here. Trying to pull you out of the normal posture where we're always pulled forward. Here, we're basically just doing the exact opposite. So take some time with that. You're welcome to stand there for a minute, 2 minutes, 3 minutes. You're really not going to overdo something like this. And this is a great one to do every single day because, again, we're trying to counteract what your body does all the time, which is that really terrible forward posture. I want to give you guys one other quick stretching option. I like this one a lot as far as it's an immediate opener, but keep in mind when you are doing just a passive stretch, it does tend to be more temporary than doing like the active ones that I showed you earlier. But this is still a great option, especially for some immediate relief. You're going to start with your palms on the floor, fingertips facing away. Just shifting forward, chest up. Make sure you're keeping the hand flat on the floor. You can also try some different angles. You can turn where the fingertips are out and stretch. And then you can really try to rotate. Good luck with this one. It's pretty rough. So this one, I tend to just be able to focus on having my palms flat. I'm not able to do a whole lot more than that because this one's really pretty intense. The more I hang out here and breathe, the more you can lift that chest. But you can play around with those angles a little bit and try to get all of that nice and opened up. If you are able to get on your knees, you also can make this a slightly more intense stretch by having the ability to press up and away that way. Also a really, really good option. This may be a little bit uncomfortable right through here, as long as it's not painful. Like right now, I feel like it was a heck of a stretch. Nothing painful, but I can just really feel I did something. Check out my website and you'll find information about my online program. What I have on there is a total body foundations program that basically covers everything from head to toe, things for even the hands, for the feet, and everything in between. And then weekly, I update it with some of my personal training programs that I do in studio with my clients. It blends 25 years of experience in physical therapy, personal training, and massage therapy.